So I am going to go ahead and auscultate your heart, but first I'm just going to check and make sure your rib slope is good. So just give me a good deep breath. Perfect. All right. So now I'm going to listen to your heart, okay?
Okay.
All right. Okay, we'll get you the rest up. Thank you. Okay. Perfect. I'm going to flip it around and listen the same way back up, okay?
Mm-hmm.
Okay. Perfect. All right. So now I am about to auscultate your lungs, but first I want to check that slope again. Make sure correct placement. Just take a deep breath in. Perfect. Every time you feel my stethoscope touch, you just take a deep breath for me, okay? All right. All right. Perfect. Go ahead and move around to your back. All right, I'm just going to feel down your spine. Great. Now could I go ahead and just get you to shrug your shoulders up and down? Great. And if you would, just flex your back towards me. Perfect. All right. Also, while I'm doing that, I'm going to go ahead and get you to take a deep breath for me. Perfect. All right, so every time I touch you, just deep breath again, okay? Perfect. All right, now can I go and get you to lift your arm for me? This one first, we're gonna do this one. All right, deep breath in. Deep breath in. Great. Deep breath in. And one more. Great.
First is a 1 to 2, and her chest expansion is symmetrical. Her respirations are within normal limit, and they're even and symmetrical without any limitations. They're effortless. Now I'm just going to percuss her lungs real quick. So there was flat over the bone part and then resonance on the other parts. And I'm gonna have you turn around. I'm gonna move your hair real quick. So I heard resonance throughout this area, and then I'm going to have you turn back around real quick once you get that back up. So I'm just going to listen to your lung sounds as you breathe in and out for me. And I'm going to be using my diaphragm. I'm not going to actually listen for a full respiratory cycle, but in a real thing you would, but I'm just going to verbalize that I would do that. So all lungs were clear to auscultation. I heard nothing abnormal. And I'm going to have you turn around. So all lung fields were clear to auscultation. listening for bronchiovesicular through, no, your bronchial through here, and then your bronchiovesicular right through here, and then your vesicular all through here, and then your bronchiovesicular through here, and then your vesicular right through here. We're gonna do the heart now, and I'm just going to, I would use my diaphragm to first listen to S1 and S2, and we're gonna go to her second intercostal space on the right side, on your right sternal border. S1, S2 present, and I'm going to listen to her, that's your aortic, then on this side is your pulmonic on your second intercostal space, left sternal border. And then Erb's point is at your third intercostal space on your left sternal border. And then your tricuspid is on your fifth intercostal space, left sternal border. I'm just gonna, and then your mitral is on your fifth intercostal space, on, not intercostal space, on your midclavicular line. So S1 and S2 is all present. And then I would go ahead and turn it around to my bell and go ahead and listen to see if I hear any murmurs in her aortic, pulmonic, tricuspid, and mitral. And the Erb's point, I should just be able to hear S1 and S2. No murmurs were present, and I just heard the S1 and S2 on the Erb's point. I'm going to have you lie down on your left side. And I would palpate your PMI. And I would usually palpate that for about 60 seconds, but for the video I'm just going to say that I was. And I have 86 beats per minute. And then now I'm going to have you sit back up for me. And then as I listen to your mitral valve, I'm going to then just feel your radial pulse. So her mitral and radial pulse was equal rate and rhythm.
There. All right. So at this time, I'm also going to palpate the eight different areas on the posterior chest. And what I want you to do is say 99 for me, okay?
Okay. 99, 99, 99, 99, 99.
All right, Texas firmest without any vibration, so no consolidation. Note it. I'm also going to go ahead and palpate the areas as well, okay? All right, percussion of the posterior wall balance, all no dullness, which is usually a sign of consolidation. Also, do you feel any pain when I do this?
No.
All right, so no CVA tenderness, no signs of kidney infection. At this point, I'm going to listen with the diaphragm of my stethoscope to the 8 fields. And what I want you to do, Myra, is say E for me.
E, 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 E.
All right, so basically all I heard was E. I heard no muffle sounds through my stethoscope, which shows no consolidation, which is a normal finding as well. Normally you would hear like kind of an A, which usually signifies that it's some kind of consolidation in the lung fuels. Now, right now, I just want you to take a few deep breaths and continue to do so until I tell you to stop, okay? All right, nice deep breath. Good. Nice deep breath. 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 And nice deep breath. All right, so lung sounds are clear in all eight areas. There's no adventitious lung sounds. There's no wheezing, no rhonchi, no rales. It is a normal finding for the posterior back. And I am right now also going to palpate your spine. Any tenderness or pain when I do this?
No.
Okay, the spine is in its correct alignment. So now we're going to move around to the anterior portion of the chest, okay? You can have a seat back on the bed. Okay. All right, we'll trade up. All right, so on the anterior portion of the chest, skin again is warm, dry, intact, no breakdown anywhere, no lesions noted, and I'm gonna listen to 4 different areas of your chest, okay? One thing I need you to do right now is just take some deep breaths when I tell you to, okay?
Okay.
Okay, deep breath. Deep breath. Deep breath. Deep breath. All right, so lung sounds are clear in all 4 areas of auscultation. No adventitious lung sounds, no rales, no rhonchi, no wheezing. And right now we're going to move on to the cardiac, which first I'm going to do is palpate each carotid. And what I would do is feel for at least 60 seconds in the carotids. They are regular rate and rhythm. They are +2 bilaterally. And now I'm going to switch to my bell on my stethoscope and listen for buoys. And no buoys noted on auscultation. Usually if you hear that, it would be a loud, harsh sound. All right, so what I'm gonna do now is feel for your radial pulses. And we'll take off your watch. All right. And again, we're gonna feel for 60 seconds. Radial pulses are equal bilateral. Rhythm is a normal rate, normal rhythm, +2 in both radial. Right now, I'm going to just get you to kind of lean backwards. What I'm feeling for now is the femoral. And again, it's +2 and bilateral femoral. And then we're also going to feel for posterior popliteal, which sometimes hard to feel when clothes on. That's why we normally have people dress in a gown only, but for this, we're not going to do that. So she has good +2 popliteal, posterior popliteal, post-tibula pulses. And now I'm going to feel for dorsalis pedis, and we feel again for about 60 seconds. And she is +2 on her dorsalis pedis pulses, which are all normal findings as far as pulses go. All right, so we're gonna move on to, now I am going to feel and for heaves or thrills, okay? So basically what I'm gonna do is feel different, these 5 percordial areas of your chest, okay?
Okay.
So the only thing you have to do is just read normal. I'm gonna go ahead and explain where I'm gonna be touching. We're gonna do the aortic area, which is the second intercostal space, right sternal border, the pulmonic, which is the second intercostal space, left sternal border, Erb's point, which is the third intercostal space at left sternal border, the tricuspid, which is the 4th intercostal space, left sternal border, and then finally the mitral area, which is the 5th intercostal space, left mid-clavicular line. This is also the apex area of the heart and also the pulse of maximum impulse, okay?
Okay.
All right, or maximum pulse or maximum intensity. All right, so let me know if you have any pain here, okay? And again, I'm gonna go ahead and feel for your PMI. I'm also gonna do it while you're laying down because it's a lot easier when you land on your left side. All right, so I feel no heaves, no lifts. And from here, what we're gonna do is I'm gonna auscultate with the bell of the stethoscope and the diaphragm of the stethoscope in those same 5 areas, okay? I'm gonna get you to set up. You can lean slightly forward. Just makes it a little bit easier to hear the sounds. And what I'm gonna be listening for is the lub dub, the S1, S2. S1 is usually heard better under here at the tricuspid and the mitral valve, while the S2 is better heard up here. And in urge point, you kind of hear it all in that area, okay? And what I'm gonna be listening for is just normal heart sounds. All right, now I'm gonna switch to the bell. And the diaphragm, we hear the harsh, the louder abnormal heart sounds, and the bell, we hear the softer ones. So that's what I'm listening for here. All right, so you have good normal S1, S2. There's no extra heart sounds, meaning there's no S3, S4. And usually S3 and S4 is better when you're laying down. So we are going to lay you down for that as well, which we'll do in just a second. Here we're listening more for the aortic or the pulmonic murmurs, which is like aortic pulmonic stenosis, aortic pulmonic regurgitation, or these abnormal heart sounds that we normally hear if you have a problem with your heart. But yours are clear, so you don't have any of that, okay? And I didn't hear any other clicks or snaps as well, which is good. Those are kind of hard to hear. Again, some of this stuff is easier once we lay you down, which I'm gonna have you do now, okay? Move your stuff out of the way. All right, so at this time, I am gonna listen to the 5 percordial areas again, starting with the diaphragm of my stethoscope. And again, I'm going to be listening for 60 seconds in each area to make sure we hear the full systolic and diastolic movement of the heart. This area is better to hear mitral valve and tricuspid valve murmurs, such as the tricuspid insufficiency, mitral valve regurgitation, or tricuspid regurgitation. What I'm also going to get you to do is, if you can, is roll that way to your left side. And again, I'm going to listen with the diaphragm. And then I'm listening with the bell. All right, you can go ahead and lay it on your back. All right, so again, no normal S1, S2, no extra heart sounds noted, no S3, no S4, no heart murmurs, no.
To go ahead and inspect your chest and your lungs. So I'll have you sit up straight and breathe in and out for me. Looks good, nice and symmetric. Any concerns with your breathing or anything?
Nope.
No? Okay. I'm gonna go ahead and have you kind of turn to the side. I'm gonna have you take a deep breath in and then breathe out, okay?
Okay.
Go ahead. Okay, that looks good. Now I'm gonna have you say the number 99 each time I place my palm down, okay?
Okay.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99. Okay, I'm just gonna do a little percussion, so just hang in there. Good. I'm going to go ahead and listen to your lungs. So when I place my stethoscope down, I'll have you take a deep breath in and then breathe out. Okay, and then I'm going to come around and listen to you in the front. So same thing. Breathe in and out. Okay, one more. Okay, good. I'm going to go ahead and feel for your carotid artery. Your pulse is equal on both sides, nice and strong. Rate seems good and steady. Now I'm going to listen to your heart. Start over here with the aortic. Pulmonary. Herbs point. I'm just going to come up here for 2 more and listen to your tricuspid and your mitral. Okay, good. Didn't hear anything abnormal, no heart murmurs or anything.
To take a look at your back and front. Just take deep breaths with me. Okay, perfect. Now I'm just going to take a listen to a few spots on your chest, your side, and your back. Is that okay? Yes. Can you just breathe in and out of your mouth a few more times? Let's do a few spots on your back. Okay, you can sit straight for me again. And I'm just going going to have to listen to one of your heart sounds over your left chest.